Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erica Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erica Mayall, and today I'm really excited to introduce you to a guest, a friend and colleague who I have known from the dance medicine community. So on the podcast today, we have Brooke Winder, and I'm really excited to chat with her about a topic that maybe doesn't get talked about enough in the dance industry. So Brooke is a Southern California-based physical therapist who specializes in dance medicine in addressing issues within and surrounding the pelvic floor for performing artists. She is an associate professor and coordinator of the dance science degree program at California State University, Long Beach, and also serves patients through her clinical practice, Renew Motion Physical Therapy Incorporated. She is adept at assisting performers in optimizing pelvic and orthopedic health while navigating common issues such as hypermobility. Dr. Winder has presented at several national and international conferences, and her research has been published in the Journal of Women's and Pelvic Health, Physical Therapy, the Journal of Dance Medicine and Science, Clinical Biomechanics, and many, many more. Dr. Winder teaches continuing education courses for rehab professionals that focus on addressing pelvic health in artistic athletes and has authored and co-authored pelvic floor-focused chapters in many books. She also regularly teaches workshops on injury risk reduction as well as pelvic floor health for dancers and dance educators. So welcome to the podcast, Brooke. Thank you so much for being here. I'm really excited to chat with you today.
Yeah, thank you for having me.
So as I usually always start with my guests, I like to hear a little bit about how you got into dance or what your earliest memories are of dance.
Oh, that's great. I started dancing when I was 3, so I was so little. I don't have, specific memories of my early dance days. I actually remember my gymnastics life a lot better because when I was really little, I was also a competitive gymnast. So I took dance classes and I did competitive gymnastics. And that was really intense for me, sort of through my elementary school years. But that was a sport that I eventually reached burnout in pretty early, I would say, by about middle school. And I realized that I was always my heart was enjoying my dance classes so much more. And I really wasn't burnt out with that. So I kind of dove into dance a lot deeper when I hit middle school and high school after I quit competitive gymnastics. So, I grew up in the studio world that way and took mostly modern contemporary. That's kind of my main forms, but jazz and tap and ballet as well, and a little bit of street dance, but not a heck of a lot.
Awesome. And I think that's actually a really common story that we hear in dance with some of those sports. I know dance also now falls into a lot of early kind of specialization. But back when you or I were growing up, I do think gymnastics and figure skating, at least in our area, were ones that really kind of forced a lot more early specialization. And I remember having a lot of other students and friends join my studio as kind of, probably 11, 12, 13-year-olds who were coming from those backgrounds and they'd kind of burnt out or reached their limit and were like, okay, what's something similar? Maybe I'll try dance or try acro dance or things like that. So I do think that's a common path, especially back then when dance was maybe not quite as intense at such an early age. That's probably changed a bit now, but interesting.
Yeah.
So I know you went on and did a BFA in dance from Chapman University, and I am interested to know at what point you kind of discovered physiotherapy or realized that maybe that was the path that you were going to go down. I know you danced professionally as well. So whether there was sort of a natural progression into that or if you'd always been interested in it, what was your journey into that?
Yeah, I do remember that, I was lucky. I had a lot of minor injuries. I had nothing that really took me out of dance for a long time. Same with gymnastics. But I did go to physiotherapy or physical therapy here in the States. And I remember thinking that it seemed like a cool job because it was something where, the physios were still like moving throughout the day. They weren't sitting at a desk. So that stuck with me. And I also remember the physios really helping me out a lot. And that made a big difference for me. And kind of, I guess, related through high school. And then when I got into college as a dance major, I did find that when I would go to some healthcare practitioners, whether that was a physician or a physio, I felt like I had to constantly explain what dance was. And I think this is a super common story that I hear from so many dancers where didn't really understand how demanding it was, the fact that we move like any other athlete at a really high level. And I felt super frustrated by that. So there was sort of this thing in the back of my head that made me really think about maybe being that person for someone later on, that maybe I could be someone who understands, the health field and actually understands dancers and other artistic athletes and can talk to them and really help them, feel supported in what they do. So I had inklings, but I wasn't sure if that was what I wanted to completely commit to. But as part of my dance major, I had to take anatomy, and I fell in love with anatomy. I thought it was super interesting and kind of realized how much I liked the sciences, particularly about the body. So I think it was always there. And then when I started dancing with my company, I danced with a small regional contemporary company that was a really lovely experience. And I also, like many dancers, I was working a couple of jobs to support my income while I was dancing professionally. And that's when I got Pilates certified, because I also fell in love with Pilates. And I wanted something that felt like, that my heart was attached to, that I really enjoyed working with people. So I started working with clients, and I realized I was always needing to work around their injuries to help support them, which was great. But I kept being really interested in how to actually help them out directly with their injuries. And I played with that for a little while, and I finally realized I also taught Pilates at a physical therapy clinic. I kept kind of coming back to physio, and finally really just decided to make the leap and realize that that was a good fit for me and where I wanted to go. So I decided to go back to school and go to grad school. Yeah.
Yeah. It sounds like the universe was kind of nudging you in that direction for a while, and then eventually sort of led you that way. And I think, like you sort of said, your experience in physical therapy, like as a younger dancer, was like a little bit frustrating. And I think we see that a lot in not just in dance physio, but people of like maybe our generation kind of decided to pursue this path because of frustration or this need that didn't exist. And so we didn't necessarily have role models. Whereas I think we're seeing that change a little bit now, where now I'm getting, even high schoolers who are like, okay, how did you get into doing what you're doing now? Like, that's what I want to do. They're seeing it as like a role model or an example. And I think there's a lot of parallels with other areas of kind of like maybe underserved populations, which pelvic health, I think, traditionally was for a while. And so can you just share a little bit with us about your journey into specifically kind of specializing in that area? Because I know, especially other friends I have who work in that specialty area, it was very similar stories where they, had their own frustrations maybe with experiences in that area. And then that led them to be like, okay, I'm going to actually become the person who can offer these services. So what was your story?
Yeah. I would say some of it is as I was getting into physio and the type of patients I was seeing, like patient issues that were coming to me. I guess similar universe sort of nudging me toward this area, because I tended to be really interested once I first started treating in back issues, low back issues, and hip issues. And whether, dancer or not, if you treat that area, the pelvic floor is the area in between. And you inevitably find out from patients that they might be dealing with things like leaking urine or pelvic pain. And so at one of my clinics, I worked alongside other physios who were specialists in the pelvic floor, as well as orthopedics, as well as other areas of the body. And so we would co-treat together, and maybe that patient would see them and get some pelvic floor specific treatment. And I realized how much it helped them, or sometimes that, nagging back or hip issue that wasn't getting all the way better was like one of the big helpers along the way was also addressing their pelvic floor. So that kind of just lit up my interest quite a bit. So that's how I really got into it. But I also reflected, so when I was a gymnast, as I kind of also hit that middle school, like toward the last couple of years of my gymnastics career, I would leak sometimes, like a little bit at practice or sometimes just not at practice. And I never told anyone because I wouldn't have ever known that this type of rehab existed, or that leaking was actually more common in particularly female athletes than people realize. So not knowing that, I never told anyone. Luckily, it sort of got better. And then as I went into treating pelvic floor, I understood some of the reasons why that was probably happening. But my own experience with that was kind of in the back of my head as well. It's like, as I started work with pelvic floor physio, I thought, oh man, if I had had this information, I would have had such a big difference really quickly with what was going on. So, so that was kind of another thing that highlighted that interest. And I started to learn that more and more performers and athletes had pelvic floor issues than I realized. And that felt like a really important space to want to help move along, I guess, as I started to learn about how to treat the pelvic floor. Yeah.
Yeah. That's like, I think a very powerful story in through there. And you kind of like alluded to the fact that like you didn't even know that like pelvic floor physical therapy existed. And I think we've seen, there was like a big wave over the last probably like 10 to 15 years, maybe even a little bit longer than that. There's been like a really big surge in people's awareness of it as a service and as something, it's like previous generations, it was just like, oh, if you've had babies, then you leak, so don't go on a trampoline or things like that. And so I think there's been a really, really big push and public awareness of the importance of it, and that there are treatment options available and physical therapy for pelvic health conditions. But I'm not sure if we've seen the same knowledge and awareness within, say, performing arts spaces. I think a lot of what we see just in terms of like the general public's awareness really still is centered around probably like pre and postnatal and kind of other populations of people. And do you have ideas at all about like maybe why we maybe don't have as much awareness within the performing arts space? Or maybe that's just my perception. Maybe your perception is completely different to that.
Yeah, I mean, that's such a good question, because I think when you're in it, it's the thing I focus on so much when I go to conferences and things like that. So in my tiny world, it feels like those conversations are starting to happen more. But I think, like you said, maybe more from the clinician side, like the people who are treating it, there's more and more dance physios that I talk to who are treating the pelvic floor and are really interested in moving that along. But I agree with you that I don't know if it's widely known to performing artists or to the general public. And, I think there's probably a few reasons why. I think we still are working hard in the dance space to help dancers realize how to access healthcare and really get the support that they need. And I don't think it's always in the conversation. We definitely have made strides in the last 10 to 20 years for sure. But I think in the general health space, we're still working hard to help dancers realize, like, who do you go to when you get hurt? Who do you have a conversation with? What should you get assessed? What should you push through and what shouldn't you? So, and then on top of that, to expect dancers to understand that pelvic floor therapy is out there when maybe they still are learning about physiotherapy in general. Maybe we're just kind of needing that time to cook a little bit, and also just to get the word out a little more with things like this, even just more conversations for dancers and for family members and people who are helping them navigate it, just to even know that it's there. Because as I mentioned, when I was a young gymnast, I would have never said anything because no one else was going to say anything if that was going on with them. And it's also a super sensitive topic, and people can feel embarrassed. They can feel shame. They can feel like they're the only one who's having this issue. And I think also dancers are such high level movers and often perfectionistic, I might say, that they're like, this is weird. Why would I even have that issue? Aren't dancers pretty strong and pretty, like, it doesn't seem like a thing that someone might experience outside of pregnancy or postpartum experiences, because that's kind of what people still associate. Yeah.
Yeah. And that brings up a great point, because like a lot of the listeners of the podcast, we have a really varied audience, but it is a lot of, maybe like adolescent dancers, a lot of competitive dancers, their parents, it's dance teachers, there's obviously healthcare providers as well. But for people who maybe this is like kind of the first they're hearing about like pelvic floor issues or pelvic health in a, like a non kind of postpartum population, what types of things, like we've been talking about sort of like urine leaking, but like obviously it encompasses so much more than that. So if there's, parents or teachers or even dancers who are listening, what types of things would they maybe be like looking for, things that, could be helped or addressed by like pelvic health physiotherapy? Because I think we see, you and I know as clinicians how much it encompasses, but like you said, there isn't necessarily this awareness. And especially with like, a young athlete or a young dancer who's maybe leaking, they might not actually make any sort of correlation between what they're physically doing and how their body's physically performing, and that like they might actually just not even see any association. So if people were to, bring things to the forefront or to their attention, what types of things are we talking about?
Yeah. And so it might be helpful to have just generally help people understand where the pelvic floor is and generally what it does. And then kind of because of what its function is, that's why people could have symptoms if things aren't coordinating well, or if it's getting kind of overworked, as an example. So, the pelvic floor muscles are the muscles that are the base of the pelvis. So if you think of the pelvis like a bowl, it's the muscles that kind of cross the bottom part of the bowl from front to back and from side to side. So for listeners who might, if you're sitting down, you would feel those muscles between those little sits bones that you sit on. And then also from front to back, from the pubic bone back to the tailbone. That's where those muscles are. And they have lots of functions, but they do need to basically contract to keep you from leaking urine. So to keep everything supported throughout the day, when you cough, when you sneeze, when you jump, when you land, anytime that you don't want to go to the bathroom, it's really there to maintain that tone. But also those muscles need to fully relax, or relax enough when you have a bowel movement. And this is going to relate to symptoms that a dancer might have. They also need to relax to be able to empty the urine adequately. They also provide support across the pelvis. They're part of the core, so they're kind of that nice floor of the core. So they're going to interact with the rest of the core muscles. They're going to turn on when we turn on our hip muscles, which I think helps people maybe imagine how they're related to dance move. Like, why would we care so much about the pelvic floor? But those muscles are going to coordinate with the abs and the back muscles and the hip muscles as well when dancers move. So those are some of the things that the pelvic floor does. It's also interacting with our breath as well. So if someone's having symptoms that are pelvic floor related, the leakage example could be just leaking a little bit of urine, maybe after you've gone to the bathroom and you stand up and you're like, hold on, didn't I finish? And like a little bit dribbles out. Mm-hmm. And that's something that often people won't share, but I've had a lot of dancers have that experience. Or not consistent, but every once in a while when you do repetitive jumping, you get a little bit of leakage. Or you might be completely fine through everything you do in dance, and then a big sneeze will cause some leakage, or like a laughing fit. So a lot of dancers I treat seem to have these symptoms that they're not always consistent. It's not like they're leaking all the time, but it's kind of at these weird times that they can't always find a pattern with. So that's something to look for. Or if it's happening more consistently. And then other things that can be related to the pelvic floor are things like having to go to the bathroom frequently, like feeling like you have to pee a lot. some of that has to do with how our brain trains our bladder as well, which pelvic floor physio can help people with. But that's like if a dancer can't make it through a whole class consistently, like a whole hour or an hour and a half class or a rehearsal, and they have to stop at 30 minutes and go to the bathroom because they feel that sense of urgency, that's something that they don't have to live with, that they can get help for, because it's really inconvenient to really worry that you're not going to get through that class. Or if you're traveling to competitions and just being able to get through a car ride or a plane ride and you feel like you have to go a million times. Some of that can be because the muscles might hold extra tension or have some patterns of holding that don't let us empty completely, or can mimic the feeling of having to go to the bathroom. So that's something that can be common as well, or more common than you might think. Sometimes if dancers have super painful menstrual cycles, which could be related to things like endometriosis or polycystic PCOS. They might also have this overlapping reaction in their muscles because they get that pain with their period. And that overlapping muscle reaction is often a lot of tension. And that tension can mimic menstrual cramps. So it can kind of overlap and just not help them and can make their periods feel worse. So that's another thing that again, it may not be all because of the pelvic floor, but the pelvic floor can be a big part of it. So yeah, there's some of the things. And then pain as well, like tailbone pain. Maybe that's even after a dancer has just like fallen on the pelvis or fallen some way and they irritated the tailbone itself, but those muscles attached to the tailbone, and they could sometimes then go into a little bit of spasming or tension, and then it can kind of mimic or keep that tailbone pain going for longer to cause pain with sitting. And then pain with things like using a tampon as well can be something that just signals that maybe those muscles need some help in learning when to relax, when to contract, and maybe decrease pain. And then sometimes people can get what's called referred pain. So they could have some tension in their muscles of the pelvic floor, but the way their brain and their body feels where that pain is then it's pain in the glutes, like in their butt, pain in their low back, or pain in their hip. And sometimes some of that pain can be referred from the pelvic floor.
Yeah, amazing. And those are such good examples because, like, you know, we were sort of saying, I think we sometimes think of pelvic floor stuff as like just, you know, incontinence or leaking, but really it can be affecting so many other things that we aren't always thinking like, oh yeah, that's maybe a pelvic. I mean, as clinicians might be thinking that, but sort of the general population.
The other thing that I meant to mention before was also constipation. Sometimes, there could be lots of reasons why a dancer deals with constipation. They may be dealing with some GI issues, but also if those muscles are unable to relax well at the right time, that can also perpetuate constipation. And that's relatively common in athletic populations too.
Yeah, absolutely. Especially with like travel schedules and things like that as well. Like we see it. So like you said, there's so many things that feed into it, but being aware of that impact on things. Because this is maybe a topic we don't talk about a ton in the dance world, and especially maybe in like studio settings and things like that, there's probably a bit of a perception that these issues are like maybe not that common. But I know that you're involved in research and you've been, you know, sort of conducting research and involved in things that are looking at like the prevalence of pelvic health issues within dance populations. Can you just share a little bit about maybe how much more common it potentially is than what we think it might be?
Yeah. So the research that is out there currently is on young professional dancers, so sort of average age of mid-20s, most of whom haven't been pregnant yet. And the rates in professional dancers seem to be somewhere around 35%. So when you think about that, that's a third. That's a huge amount. Have some type of experience of leaking urine. And also a fair proportion have issues that seem to signal pelvic pain. We just haven't researched the pelvic pain like prevalence, how common that is. So that's hopefully coming.
Yeah.
In performers like circus artists who do aerial work, pretty high numbers as well. We've looked at kind of a bigger age span of adults, and that can be up to 40-45% of people experience leaking. So we know it's common. And when we look at research on other sports, particularly with female athletes, we're at pretty similar numbers. So high-level female athletes do experience this, at least around a quarter to a third of them on average. It kind of depends on the sport and the demands. We don't have, I am working on a study that we're just starting in adolescent dancers, but we're at the beginning, so we just don't really know the rates because we do sort of suspect and we see it clinically and see that dancers are having issues like maybe having to go to the bathroom frequently through classes, maybe leaking, maybe having some other issues that we just need the data on. But some of the research on competitive gymnasts, rhythmic gymnasts, and artistic gymnasts have been on adolescent populations, on teen populations. And it's a pretty large amount, like almost up to a third. I'd have to look at the exact numbers, but it's a good chunk that are experiencing that. Both on the leakage side and having some type of pelvic pain. So my suspicion is that because our movement demands are somewhat similar to those types of populations, that it is happening in our adolescent dancers. And what could be helpful is if that's a sign that maybe some things are imbalanced or they maybe need help in that area, that if they take care of it in adolescence, that could be a great way of preventing it from becoming this annoying problem as they develop into their higher level years or as they grow into adulthood. And there is good evidence sort of showing us that if we can help people out with these issues when they're younger, that's just another thing that will decrease their risk of having pelvic floor issues as they traverse through life.
Yeah, absolutely. And like I was aware of those numbers just from like presentations at conferences and stuff like that. But I think in the general population or just like the public's perception, I think people assume that these would be like exceedingly rare, and especially in like an adolescent or a young professional population who have not had children yet. And like we know that to not be true. And so I think especially for the teachers listening, it's something to be really aware of because sometimes you hear teachers get a bit annoyed about like, oh, this kid's always like asking to leave class to go to the bathroom. And they think that like, perhaps it's a way of them like kind of slacking off or, there's all sorts of these preconceived notions surrounding it. But
yes,
when we think about those numbers and it's potentially, and I know we don't have the data for adolescent dancers, but, potentially a quarter or a third of the dancers in your studio may actually be experiencing some sort of pelvic floor symptoms. There actually could be very valid reasons for that student. And like you said, like those are issues that can be addressed, but for teachers to not automatically jump to the assumption that like, oh, it's ballet and they don't like ballet. So they're like looking for any excuse to leave the classroom or like they don't like doing tendus or like whatever it is. So yeah, I think it's a really important point to bring up for teachers.
Yeah. And something to think about for teachers, I mean, teachers in general, us physios also, when we have a busy treatment day, probably relate that to maybe understand if that could be happening in their students, but also for themselves, the connection between how our brain and bladder interact in our nervous system is such that you really can train it intentionally or not intentionally. So if you're a teacher where you've got several classes in a night or you're teaching at a workshop, you have kind of this regular schedule where you don't get breaks and you can't leave the students on their own. You might have experienced this on your own as an educator where you're like, I always have to pee on this hour, kind of no matter what, because I've kind of got to either do it just in case because I've got that next class coming, or I've had to hold it too long. And so teachers can develop some patterns that feel inconvenient just because of their schedules. I mean, elementary teachers that can, and in just like the school system have such a busy day. So I think that might be another way to have dance educators just kind of understand how that might look. Because maybe those students just kind of like, you just always have to go to the bathroom at the same time. And then once that becomes a habit, your bladder kind of gets used to sending that signal, even if your bladder's not full. And that can get confusing for the body.
Totally.
But if a dancer, if one of your students feels like a ton of urgency, they might feel like they're going to leak, even if the leakage isn't actually they might just have this urgency problem, and they'll feel like they got to run out of the classroom and go use the bathroom. Yeah.
Yeah, for sure. And I actually remember this is 30 years ago, probably at this point, but remember a specific teacher that I had growing up who actually talked to us a lot about this in terms of like the sort of quote unquote nervous peeing, like backstage, where all of a sudden you'd be like in your costume in the wings and some kid would be like, I have to pee. And she was actually very like probably ahead of her time knowledgeable in terms of it being that like nervous system and like this psychological connection to it, and being like, okay, it's just like a nervous, like you don't actually have to go like, so we actually talked a lot about it when I was a kid, but I don't know that that's common. And also I do think a lot of dancers can identify with the nervous pee. Like it's like, even if they've not connected it to any sort of like pelvic floor kind of education or knowledge, it's like people can really be like, oh yeah, I definitely know that as soon as I'm nervous and like I feel like I have to pee, even though I just went pee 2 minutes before.
Yeah. And especially like the moment they say places.
Yeah.
Like
there's one keyword and you're like,
Yeah. And people will kind of call that like the key in the door thing, where like some people will get that urgency every time that they're about to unlock their front door or like come in through the garage. And like just the key in the door is like a trigger for us to feel like we have to pee. So that calling places tends to be our
tends to be the thing in the performing world.
Trigger. Yeah.
Yeah. For sure. Circling back a little bit more just to the dance teachers, do you see, because I know like just like from my work clinically, we often see certain issues kind of develop or like pop up sometimes with like cueing that teachers are using in their practices. And we see this a lot with some of the like really kind of, I'm going to say old school, but cues that were maybe used a lot when I was a kid growing up that now are hopefully not used as much, because we know that they cause some issues in terms of how people are like recruiting muscles or holding their body. And are there things that you see clinically that are very, very common that seem to kind of perpetuate pelvic floor issues? Like, is there certain cueing and stuff teachers could or should be aware of that might help in like preventing some of these issues?
Yeah. One thing that seems to be a common pattern that just doesn't necessarily help, especially if a kiddo is already maybe dealing with excessive tension or difficulty relaxing their pelvic floor. Maybe a couple things. One is like the pulling the belly button in or like pulling the abs in. And I got taught that way a lot. Like you said, I think it's been a common thing that has followed common cueing in some forms of dance. Is like, okay, turn on your core. And I think if a student is taking that and they're like a real high achieving student, they're like, okay, you mean I've got to hold it in all the time.
Like 10%.
Yeah, they'll do it more than they even maybe need to. Even when they're just standing there, like if they're in the ballet class and they're just at the bar and they're not doing a high load activity, their abs don't need to be tightening that much because they're just standing there and maybe moving their leg in like a tiny rond de jambe or something like that. So I think that cue in some students is not always helping them, because I've seen it develop into this habit where they're really thinking about their core as pulling their belly in or up, or like knitting in, or holding that tension. And then also I think that cue sometimes gets related to this like pull up and in, which I think they end up like recruiting their pelvic floor a lot and pulling it in. So, I mean, dance teachers are so good at coming up with imagery that I think if you're a teacher and you want to play with other ways that you could be cueing students, the thought or the image that you might have in your mind is that a strong core is not a rigid core. And I think the students need to know that too, that like being strong in the center doesn't mean that you're really held. And we can see that, right? When the dancer is too held and too kind of like pulled in, that they're not able to flow and transition through movement. But that even the pelvic floor and the abs, like they do need to breathe, and it does need to be like a dynamic system, like images of just like, it's like a jellyfish. It's just something that increases in tension and decreases in tension depending on the task. And any way that a teacher might think about that in the way that they're watching their students and cueing students could be helpful, because that up and in cue is something I've had to help dancers who I'm treating with pelvic issues, low back issues, hip issues, just like let it go a little bit, let it soften, and kind of remind them that your core muscles should probably kick on when you do harder stuff anyway. It's kind of an automatic thing. Yeah. So like cueing their bony alignment or cueing like an external task sometimes could be another option.
Yeah, for sure.
And then I think for turnout or like externally rotating the hips, sometimes that cue of like really wind it or find it in your underbutt, some of those students take that as tucking their pelvis under and like gripping their butt. And I think teachers often see that, but I think that's just one thing to kind of flag. If you see that grippy student pattern, that actually ends up sometimes perpetuating some of their maybe tightness patterns in the pelvis. And it actually doesn't free up their hip a lot. They actually feel really restricted in their hips. So that's another one that can be unhelpful for some students, for sure.
Yeah, absolutely. Yeah. And we see that even just clinically, not treating pelvic floor, but just with hip issues in general, where it's like that same pattern. And so, really encouraging dancers to actually then access internal rotation and like to, kind of find that freedom in the hip. But obviously, because so many of those pelvic floor muscles are so intimately linked, especially to those deep hip rotators, I can see how that would absolutely contribute to some pelvic floor problems as well.
Yeah. And I think the feeling I think a lot of dancers have, because they're such high achieving movers, and dancers are so good at taking like really specific cues. They're like, feel your right big toe and the energy line going up and around. And like, a dancer will be like, yeah, I got that. Yep. I feel that really specific cue. And not everybody can tune in that way. But I think sometimes that can turn into dancers, like as students, really going, ooh, should I want to feel this. Like, I know I'm supposed to use this muscle, so should I feel it? And sometimes I have to tell them, like, it's going to turn on, and I promise it's turning on.
Yeah, and you're not going to feel it the same as your quad or something turning on.
Yeah, like you don't need to make it turn on before you start. Like it'll come with you. Yeah. And that could be another thing kind of to think about with those students that have that tendency to really want to achieve a muscle contraction in a certain area.
And you see that just in their standing posture and stuff. I'm sure every teacher knows exactly which students we're talking about, because they're often, even personality-wise, the ones that are just like, giving 110% at all times and really that like kind of really work hard and kind of perfectionist personality. And sometimes it's like, okay, we need a little bit of fluidity and letting go and not like working harder in some of those answers.
Yeah, for sure.
Amazing. I'm just aware of the time, and I want to make sure that there isn't anything sort of big that we've missed in terms of when it like comes to talking about like dancers and performing artists and like pelvic health before we head into our wrap-up questions. So is there anything that we haven't touched on that you'd really like to chat about?
Sure. Maybe two things that are sort of emerging a little bit more. So one is that we do suspect that more hypermobile jointed people, I mean, there is research showing this, that people have real hypermobility in lots of joints and genetic hypermobility syndromes, that they may be at higher risk to experience pain in the pelvis or pelvic floor issues. And there's probably lots of reasons why that happens, but that's also just maybe one more thing to think about, having in mind for dancers that are managing super bendy bodies, that it is very common for super bendy bodied people to have a pelvic floor component of the issues that they deal with. And so that that is something that would be unsurprising to me, and maybe we should just kind of keep in mind and explore. And a lot of the ways you can address helping them is really making sure that they have strength and stability to support that. But there's some, if they've got other issues like histamine responses, like lots of allergic reactions, that can overlap and contribute to pelvic floor symptoms and things like that. And then maybe the last piece that could be interesting is we are sort of starting to be curious. The International Olympic Committee is kind of starting to look at this with low energy availability. So prolonged nutritional deficit, that may be also a risk factor for people experiencing things like leakage of urine. And so, in terms of just understanding that the pelvic floor is kind of related to so many body systems, that sometimes they might be having that issue and the problem didn't really start with their muscles. Maybe it's a fueling issue and their body is really overworked, or maybe they're trying to really manage hypermobility overall, and the pelvic floor just tends to be a place that takes the brunt of things. So those are kind of two other pieces that I think it might be helpful for the dance world to know and think about in terms of pelvic health.
Yeah, absolutely. And especially for the clinicians listening too, especially with that. And I had heard that as well with the sort of like potential connection to like the relative energy deficiency. So that will be a very interesting area to kind of keep an eye on, because I think we're starting to learn a lot more about that in athletic and dance populations. And so it will be interesting to see. Amazing. All right. If you will indulge me, I always love to finish guest podcast episodes with 5 kind of, I call them rapid fire questions. They don't have to be that rapid. But the first one is, what's your favorite genre or style of dance?
I love sort of like a hybrid modern contemporary, very quirky movement. That's my favorite.
Love it. Would you rather be on the stage or in the studio?
My younger self would have rather been on the stage, and now I would like to be in the studio. Yeah.
Fair. If you could dance with or share the stage with any dancer, past or present, who would it be and why?
Sylvie Guillaume, Paris Opera Ballet. Just, even though I'm she did a lot of contemporary work, but just like such a beautiful, like passionate mover. I probably would have been completely intimidated to dance on stage with her, but it would have been amazing. While she was in her, in her career, it would have been so cool.
Yeah. Amazing. All right. What's one thing that you would go back and tell your younger self as a dancer?
Strength train. I think I did a lot of wishing and hoping that I got better at things. And if I had just known that there was actually an avenue to do so,
you could have actually done something about it.
Yeah, 100%.
I totally identify with that as well. You're just like, I really wish that this was better.
I guess I'm just not good at lifting my leg, but I could have strengthened it. Yeah,
100%. Dancers these days don't know how good they have it in terms of like how much more knowledge there is. We just were like out there, like, All right.
And hoping.
Exactly. Last question. If there's one thing that you could change about the dance world, what would it be?
Ooh. I would love if everyone got paid what they're worth, because I actually think it would help solve so many, not every issue, but it would help solve many issues. It would solve healthcare issues. It would solve people needing to work so many jobs when they're in the prime of their performing career. I think dancers would feel so supported for the amazing things that they do, and dance educators would feel valued for the amazing things that they provide to students. So I wish everybody could get paid what they were worth.
Yeah, absolutely. You're right. It would change so much within the industry for sure. Yeah. All right. This has been an incredible chance to catch up and to chat about the pelvic floor. If people want to connect with you, learn more, or just have questions, is there somewhere that they can reach out?
I do. I am on Instagram. I don't post as frequently as one could, but I'm at Dr. Brooke Winder PT on Instagram, so people can kind of check out. I usually post when I've got new research out or a workshop happening, and that also can link to my website. And my clinic website is renewmotionpt.com. And people can email me through that.
Yeah, and I'll put those in the show notes so people have access to the links from that. So thank you so much for joining me today. I really appreciate you taking the time to share all of your knowledge with me and also all of the podcast listeners. And for everybody out there listening, thank you so much for joining as well. I know you could be doing anything with your time, so I appreciate your time and attention to this topic. I hope you all have a great rest of your day.